Hi, I'm Bethany and I'm one of the nurses here at 21D. Today I thought I'd just do a little video to show you what you will get inside your 21D goodie bag. We will provide you with this on your surgical reset day. When you arrive at our surgical site, you will be greeted by one of our team there and they will go through some medication at first that has been prescribed for you going off your medical history. The medication that you need to take home will be put into this bag ready to take home with you. All instructions on how to do so will be given to you by a member of our team. After surgery, when you come out, you may find that you're quite oozy. This is normal and it is case dependent. Everyone is very, very different. We will provide you with some gauze. However, we don't want you to use the gauze unless it is instructed by a 21D clinician. Before you leave our surgical site, we will check that your bleeding is okay and that you have clotted very nice. We don't want to keep using the gauze after surgery as we want the nice, juicy, healthy blood clots to stay in place. If we keep taking the gauze in and out of our mouth, we may take those blood clots away and we might start to get a little bit of bleeding. If bleeding does persist and you are concerned about the bleeding, then what you can do is get in touch with your support team and they can instruct a clinician and we will advise on how to use the gauze. In your bag, we will also provide you with some of our disposable ice packs. These ones are really good for the journey home or if you are staying in the hotel that night. What you just need to do is simply crush the ice pack and just rest it on your face. These will last about 15 to 20 minutes or so before the cold starts to wear off. For 72 hours after surgery, we do advise that you have lots of cold fluids, cold ice creams, cold milkshakes, and supply yourself with lots of cold on the face. This will really help with any swelling and any bruising. Once you're home and rested, we will also give you a luxury ice pack. This one you can keep reusing over and over again. You just need to pop it in the freezer when you get home. With this one, because it has been in the freezer, it can stay very, very cold for a long period of time. You don't want to keep it in the same position on your face for a long period of time. Just keep moving it around the face and then you don't freeze the skin. After 24 hours, and only after 24 hours after your surgical reset, you want to start using our Blue M oxygenated mouthwash. The Blue M oxygenated mouthwash is really, really good to help with healing as it provides oxygen to the soft tissues. You only need to use this whilst you are healing. It's not mandatory that you continue to use Blue M. It can be quite expensive. However, we do provide it for you on your surgical reset day just whilst you are healing. With this, you don't want to rinse rigorously as you can dissolve any clots in the area. You just want to simply tilt your head from side to side and just give your mouth a really good rinse out. Next is a different mouthwash. This is called Peroxyl and it's provided by Colgate, and you only want to start using this 7 days after surgery. This one is just an everyday mouthwash. We want to try and stick to this one and not any other of our supermarket brands as they can be quite acidic. This one is a very gentle mouthwash and it has less ingredients and it's really good for maintaining your oral health after your surgical reset. Moving on to your oral hygiene and looking after your implant and your prosthetic once you are in a prosthetic state. First of all, we have our sonic toothbrush. This is an electric toothbrush and it's a sonic, which means that it will vibrate and the vibration dislodges any bacteria on your prosthetic. With the toothbrush and whilst brushing our teeth, all we need to do is brush around where we can see the teeth part of the prosthetic. You do not need to start brushing around your gum line. That will have healed very nicely by the time that you start using this, as we only advise that you use this after 4 weeks. During the 4 weeks, you should get yourself a soft toothbrush. The baby ones are really, really good. Just any really soft bristle brush is really, really good for looking after your prosthetic during those 4 weeks. You want to stay away from the gum line and just brush the prosthetic area. if you are not brushing around where what looks like a tooth, then you're probably in the wrong place. The electric toothbrush will do all of the work for you, so you don't need to brush harder, just let it do its job and just hold it and just move from side to side on both the upper and lower prosthetic. Okay? With your toothbrush, you want to use a fluoride-free, non-gritty toothpaste. You don't want to use any whitening toothpaste or anything like that, as it can be quite abrasive to your prosthetic. You want to use a toothpaste that you can rub between your fingers and it just feels really smooth and not gritty. The best toothpaste that we can recommend is probably a baby toothpaste. They are quite low in fluoride, fluoride-free, and they're non-abrasive. You can get this with a soft bristle toothbrush like we recommend in the 4 weeks of healing from any supermarket. This is your water flosser, which we'll also provide with you on your surgical reset day. Again, just like the sonic toothbrush, you only need to use this 4 weeks after your surgery. This is really good for dislodging any little bits of food that may get stuck between your prosthesis and the gum line. You can just fill this with water, and I would recommend that you do use it in the bathroom, which you will thank me for later after your first use, because it can get quite messy at the first time until you get the hang of it. You just want to fill the bottle with water and attach one of the nozzles, and you basically just use it like a little water gun, and you just jet the water through where the gap is on your prosthesis and the gum line. The gap is very minimum, but it has to be there as your cleansing space. We do say that if you forget to use your water flosser or your mouthwash, not to worry, as your saliva is the best form of mouthwash that we recommend. Your saliva is full of antibodies and it will fight against any bacteria that may be there. However, this is really good for if you've eaten and you've got little bits of food that you can feel stuck. This will just jet anything out. Last up, in your 21D goodie bag, you may find that you have a bottle of Lucozade in there. This, like I said, mentioned before about the medication that we will give you prior to surgery, we will also give you a painkiller in the middle of both jaws. We give you this with a little bit of Lucozade, as you probably won't feel like eating much that day and your sugar levels could be a little bit low. So we just give you this to take home with you on your journey and back at the hotel, and then you can keep your sugar levels up and take any medication with this provided. If you have any questions, which hopefully I have answered, then please reach out to your support team and they will contact us and we'll get you the answer. I wish you the best of luck on your surgical reset day and hope you have a really nice journey and happy healing. Thank you.